Rehabilitation services focus on assisting a patient's return to their activities of their daily lives. This often requires the use of exercises, adaptive equipment, and functional activities. Joining us now from the UNM Sandoval Regional Medical Center is Dan Lint-Coop, the Director of Rehabilitation Services. Dan, thank you for being with us this morning.
Thank you for having me.
So you guys cover it all rehabilitation services. Give us just a quick overview of what you do for your patients.
Well, in our case, Rehabilitation Services really makes reference to the choosing of certain exercises or activities geared toward movement patterns to try to help patients recover from an illness or from an injury. So as an example, physical therapy, we work with patients that are changing postures. So you think of running, you think of walking, rolling, jumping, those kinds of activities, whereas an occupational therapist works with patients that have trouble with activities of daily living, and these are the things that we commonly take for granted, like changing our clothes or feeding ourselves, what we would call self-care. I've got speech therapists on staff. They help patients after an illness or injury that are having difficulty swallowing or communicating in and of itself. And then we're lucky enough to have somebody who functions with patients or works with patients with pelvic floor issues, meaning that they have pelvic pain, they have issues with incontinence. And that's a very rare specialty, but one that is commonly overlooked, and patients that need that service are very grateful to find that we're available. So
even as you just heard, services or services that are provided can be very, very unusual.
Right.
So if someone has got sort of an unusual condition, they think no one can help me with this, reach out to you guys, because odds are you can help them.
Well, we're very fortunate at Sandoval Regional Medical Center. We have specialists in a number of different fields or elements of therapy. We've got sports physical therapists, we've got spine specialists, we've got hand therapists that work specifically for people that have issues with their hand after an injury or an illness. We've got, so many different variety of specialists within our staff that they can, collectively work together, collaborate together, come up with an individualized plan of care so that we can really target an individual patient and really help them in situations, as you said, where maybe they've tried A, B, and C and just are really at their wits' end and haven't found something that really helps them. We can commonly help people get their life back, and that's what it's truly all about.
Yeah, that's really important, is getting it back on track. So speaking of timelines, I mean, obviously, depending on the physical therapy, the severity of the situation, what are typical timelines, though, when someone first comes to you as a patient with a situation for either occupational therapy, rehabilitative services? Are we talking months, weeks, years? Does it really vary?
It can vary. Sometimes people have an elective surgery. So if they're having their ACL reconstructed, they're having a total hip or a total knee, we can pretty well pan out what the outcome's going to look like. Following a certain protocol, we can have a pretty good idea. Other patients that have had a stroke, as an example, they can require a much longer duration of time. So, I would say standard is typically 4 to 6 weeks, where we're seeing these patients a couple times a week. But, it's not uncommon for certain diagnoses that are a little more lengthy, a little more complicated, that we might see these patients for 2, 3, 4, 5 months at a time.
Gotcha. And of course, obviously the big question everyone thinks about when we're dealing with our medical services is, of course, insurance.
Absolutely.
You guys work with insurance.
Absolutely. Nearly every insurance company has some kind of a benefit that covers physical therapy, occupational therapy, speech therapy. Oftentimes this is dictated in your plan, and you can just read over your plan or call your insurance provider and find out that information. But I have people on my staff that make that telephone call. If there's any pre-authorization, meaning they have to get approval in advance, they do that, because we don't want to surprise our patients. We want them coming to be able to focus on just recovery and getting back to the game, getting back into what they need to do.
Yeah, so important.
Take care of that element for them.
So clearly you got friends on your side, Sandoval Regional Medical Center. Very quickly, if they want to reach out to you, get more information, what is the best way to do so? So
the best way to do so is either go into our website, that's www.unmsrmc.org, or you can call us directly at our offices, 505-994-7131, and we would just love to take care of you. My staff is all enthusiastic. We're a bunch of passionate people about getting people well, so
ready to work.
It's a great opportunity.
Doctor, thank you so much.
Appreciate
and again,
it.
guys, for more information on UNM Sandoval Regional Medical Center, head over to casa.com.